Well, today we are joined by Dr. Nadi Marah, an interventional and structural cardiologist from Modern Heart and Vascular. And I know you have some important information when it comes to PAD. Can you tell us first what that stands for and what do we need to know about it?
Definitely. Thank you for having me here today. I really appreciate this. PAD stands for peripheral artery disease, and it starts off as plaque. And plaque is a combination of cholesterol and fat that builds up in your arteries and over time can cause blockages, which limits blood flow to your tissues. And as a consequence, you can have symptoms, and this is what we call PAD.
And who is going to be at risk more so for this?
This is a very good question. PAD, the risk factors for PAD include people who have things like diabetes, high blood sugar, people who have high blood pressure, people who have high cholesterol, those who happen to be overweight or obese, smokers, and even those who have underlying kidney disease. But those are what I call the modifiable risk factors for PAD. There are also the unmodifiable and non-modifiable risk factors, which include age, above age 60, those who have a family history of PAD, and also patients who unfortunately have just poor genetics. Mm-hmm. Okay.
And we are curious, what are some of the signs that people need to be looking out for? Maybe they're already above the age that they need to be looking for this, but are there some other signs?
Yes, there certainly are. The unfortunate truth is that up to 40% of people with PAD don't have any signs.
Oh, wow.
Yeah, and those who do have signs have things like leg cramps, resting leg pain, have loss of hair distribution in their legs, poor toenail growth, have ulcers or wounds, and things as such. Those are the main signs of PAD.
All right, and how are people able to test for this, or how are you going to be able to diagnose PAD?
Yeah, so the first thing is to at least know what your risk factors are, mm-hmm. and if you have those risk factors, discuss this with your physician or your cardiologist. The next most important thing is when you do get seen by a physician, make sure you get a thorough physical examination, from top to bottom. So what we do as providers is we examine your feet, we check your pulse, we check to see if there's a temperature difference. One leg compared to the unaffected limb. We also check your blood pressure in your arm and your legs, and based on those findings, you can tell us if you have limitations in blood flow down to your feet and circulation issues.
Well, it's very important for people to be going to their doctor to check for this. Is there any more information or anywhere else people can go for more information on this?
Oh yeah, there are several resources online that people can look up. We follow several guidelines when you treat vascular disease, and we will definitely give you information on what to look for PAD online.
Awesome. Well, thank you so much for joining us today, Dr. Marah. We appreciate all of that helpful information.
No, thank you very much for having me. I really appreciate it.